This video will demonstrate the insertion of a superior trunk block catheter using a catheter-over-needle set. Note that preparation of the equipment and draping of the patient are not shown, only the insertion process itself. The patient is placed in a supine or partial lateral position with the head turned and flexed away from the operative's shoulder to create more working space. Rotate the probe obliquely to create a long subcutaneous tunnel with a posterior insertion point to prevent subsequent catheter tip migration. Advance carefully towards the superior trunk. In this case, we are aiming to pass between the superior and middle trunks. The plane between these trunks is explored with careful probing motions and hydrodissection. As the plane opens up with the jet of local anesthetic, advance the needle forward into the space that is created. The needle should be advanced all the way to the medial edge of the superior trunk, which is where the catheter tip will eventually lie. Once that has been reached, hold the introducer cannula steady and withdraw the internal stylet. Substitute it for the internal cannula, which will already have been primed with local anesthetic and fluid ready for use. Use the ultrasound to verify the position of the catheter. And we see here that the tip is lying under the superior trunk with good spread of local anesthetic during test injections through the catheter itself. Now the catheter may also be placed above or superficial to the superior trunk, and this may result in better motor sparing of the hand if your surgeon is concerned about motor testing after the operation. In the same way, hydrodissect the plane between the deep fascia and the superior trunk to advance the needle forward over the superior trunk and to its medial edge. Again, this is where we want the catheter tip to lie so that there is a safety margin for any tip migration post-operatively. Once the catheter has been inserted, check its position with ultrasound visualization and test injection. Here is the most important part of the process, and that is securing the catheter so that it doesn't dislodge. Use small tegaderm or similar transparent dressings. Make sure that it is placed high up with the edges well adhered so that it stays out of the way of the surgical field. In this way, you can guarantee that you will reduce the risk both of dislodgement as well as disruption during operation.